Hi, I'm Caitlin, an audiologist, and I'm here to share some tips and tricks on how to get your venting right so your first fit is successful. It can be challenging to determine the best hearing aid venting for a client to meet their audiological needs and manage occlusion. You need to ensure the hearing aid is powerful enough to treat their hearing loss, will fit in their ear properly, and sound comfortable. Too large of a vent and the client may not hear well enough, or feedback may occur. Too small of a vent and the client may experience too much occlusion. All of these issues could cause an individual not to wear their hearing aid. So, how do we get the venting right? We need to consider our client's audiogram, anatomy, and their perception of how it sounds when demonstrating some hearing aids. Let's start with the audiogram. The audiogram is our guide in selecting the appropriate style and fitting level. It also drives the software's venting recommendation, as different audiograms require different venting. So when determining the venting for your client, you want to look at the audiogram. First, we'll want to think about the severity. So how severe is the hearing loss and how much gain is required? More gain means more potential risk of feedback, in which case we'd want less venting. We also want to consider the configuration. Venting affects gain below 2000 hertz. So in this case, with normal hearing in the low frequencies, we want more venting, even an open fit, so those low frequencies come in naturally. And an individual with this type of hearing loss then might be more susceptible to occlusion. In this case, with low frequency hearing loss, we want less venting because we want to keep those low frequencies in the ear canal. And we want to, of course, consider the type. So mixed hearing losses and conductive hearing losses require more gain, again, meaning more potential risk for feedback. So we'd want less venting. We also want to consider the anatomy. Does your client have a history of ear surgery or drainage? In which case, we want more aeration and more venting. We also want to consider how their ear canal may be moving with their jaw. That could be a potential for more feedback and sound leakage, so in those cases, we'd want less venting. Smaller ear canals means there's going to be less options for venting, while large ear canals allow for more venting options. And then finally, we want to consider their perception. So give them a chance to wear some hearing aids, even if they're not the exact style that you'll be prescribing or fitting. It gives them a sense of what would it sound like and feel like to wear a hearing aid. And it also gives you a sense to see how would it really fit in their ear canal. This way you can establish realistic expectations and adjust the venting accordingly. Tip. Evaluating the fit using real ear measurements can help you see what's actually happening in the ear canal. For example, if the gain is below target at frequencies lower than 2000 hertz, you can plug the vent. This also helps eliminate feedback. Conversely, if the gain is above target at frequencies lower than 2000 hertz, you can enlarge the vent. So, when selecting the venting for your client's hearing aid, be sure to consider your client's audiogram, their ear anatomy, and their perception. Doing so will lead you to a successful hearing aid fitting the first time.